The lethality of their power is greater than ever. Their capacity to impose control over the politically awakened masses of the world is at a historical low. In earlier times, it was easier to control 1 million people than physically to kill 1 million people. Today, it is infinitely easier to kill 1 million people than to control 1 million people.
This is part 2 of a series of reports exposing the golden goose of the big pharma drug cartel, the cancer industry. This segment reveals how alternative treatments have been condemned by the medical mafia under a corrupted rule of law exercised by the FDA. This compilation proves that the big pharma cancer industry, the American Medical Association, and the FDA are actively conspiring against homeopathic cancer practitioners and natural cures for more than 100 years. This segment addresses the history of persecution against holistic and natural cures by the FDA and the AMA, which exists to this day.
In a small town in northern Ontario, the year 1922, Green Case first learned of a cancer remedy which she termed ESSIAC.
Unbeknownst to history, this fragile Canadian nurse has heroically managed to cure thousands of people from cancer with a simple concoction of herbs. While nursing an old patient, Renee noticed that she had a scar on her breast. The patient said it was left over from a cancer she had cured over 30 years before, using a mixture of herbs suggested by the medicine man from the local Ojibwe tribe. Renee tried the same formula on her aunt, who had recently been diagnosed with cancer.
I went down and I asked Dr. R.O. Fisher, who later was Dean of the University of Toronto, if he would watch over her, if I would try some of these herbs. And he said he would. And it took quite a while, but she got better. And she lived for 21 years.
After that successful experience, Renee quit the hospital and began curing people with a mixture of herbs that would become known as ESSIAC, which is her last name, spelled backwards. Soon, the voice spread, and the number of patients healed from cancer started to multiply.
In about 1943, I was diagnosed in Toronto General Hospital as having a growth in the bowel which was inoperable. And that was in January, and my husband was told that when the snow was gone, I would probably be gone with it. So through friends, I was directed to Miss Case, and I came to her and had treatments from her for practically 3 years, and felt I was cured, and I've had no return of it since.
Dr. R.O. Bastido of Bracebridge sent me a patient, cancer of the bowel, Bert Rosen, and I cured him. So Dr. Bastido went before the town council and mayor and persuaded them to give me a building that they had taken for taxes as a clinic, that I had made a great discovery and that I should be supported in my own hometown. So they set up the clinic where I treated for 8.5 years.
In a few months, the clinic was fervent with activity, with patients flocking in from all different places.
Her clinic would be full every time we were there. And there were people came in ambulances who were not able to come in for a treatment. She would have to go out and administer the medicine out in the ambulance. Then as the time went on, we watched these people be able to walk in. And finally, they were driving their own car to get SCI.
I treated from 300 to 600 patients a week. And the only way they would allow me to do this was free of charge, and I had to have a doctor's diagnosis for every case I treated.
So we brought diagnosis, a nurse case, and I took treatment from her every week for about a year. And I have no cancer today.
It was one Dr. Leonardo from Buffalo who had immediately recognized the potential of Renee's cancer cure to warn her of what was waiting ahead.
Dr. Leonardo, he was a cancer surgeon, and he said, "You think you have a cure for cancer?" I said, "I'm way beyond thinking I know." Then I had 5 other doctors in examining patients, and he asked if he could go in with them and examine patients, and I told him he could. So then he told me, he said, "You have it, but the medical profession will never let you do this to us."
After a while, a mysterious group of entrepreneurs showed up, offering Renee $1 million for the secret formula. But she flatly refused, as they would not guarantee that her cure would be made available for free to anyone who ever needed it.
Green case was called before the legislature in 1938 to determine ESIAC's legal status.
I was trying to legalize my treatment, and the patients went out and got this petition signed, 55,000 names on it. And I went before the legislature and I lost out by 3 votes.
Public outcry forced the establishment of a cancer commission to investigate herbal remedies. The greatest majority of Reen's evidence was rejected.
You see, they said the doctors all made mistaken diagnosis, that that's why the patients thought they were cured. I kept on my clinic as long as I could until they stopped the doctors from giving a diagnosis, and then I had to stop. And it's a sad thing when somebody comes and they have somebody that is ill with cancer and the medical profession can do nothing for them, and they beg of me to treat them. It's a very, very sad thing to turn them away. And I had a nervous breakdown over that, so I really had to stop. I don't see how they can refrain from recognizing it, because if you have the proof, you have the diagnosis from the doctor, you have the pathological findings, and you find you have the living patient to show that they are still alive after the medical profession has given them up. And yet they refuse to admit that it is a cure.
After she recovered from the breakdown, Renee started again from scratch, brewing the herbal mixture and curing patients in her own basement.
I have to grind them. I used to get them already ground.
Soon the authorities began harassing her again, having her arrested more than once for the most preposterous reasons. But the fame of ESIAC had already crossed the border, as one day Renee received an invitation to scientifically test her herbal remedy from a clinic in Massachusetts.
About 20 years ago, 1958, here in this lavatory.
Its director was Dr. Charles Brush, who was also President Kennedy's personal physician and a close friend.
Undertook to study the effects of a drug or an herb called ESIAC. And we found that it was non-toxic and did have effects in help in the treatment of cancer. And as a result of this...
At that point, Dr. Brush recommended ESIAC to be tested for toxicity in order to be approved by the FDA as a possible cancer cure. But once the herbs arrived at Sloan-Kettering, one of the most important cancer research centers in the country, the process somehow got bogged down by inexplicable delays and eventually never came to a conclusion.
The results that I reported to Reen case were studies in sarcoma 180 in the mice, in which we were looking not only for possible primary inhibition of the tumor, which did not occur, but also for regressions. And there was a very small percentage in a small group of regressions, but we never had the opportunity to confirm this and to see whether we could obtain better results.
Nevertheless, ASIAC was not approved by the FDA, exactly as predicted by Dr. Leonardo 30 years before. Further attempts to legalize the cure were made by different groups of patients who went as far as suing the medical authorities for denying them a possible cure for cancer.
Permit them to have ASIAC. They're asking to be given the right to use ASIAC since orthodox medicine no longer has any answers for them.
You can't burn a cancer out of a body with radiation. You can't poison it out of the body without poisoning the body as well. And I feel that nature holds the answer, the only answer for cancer patients, and as such, we should have it. Our constitutional rights at the moment are being denied to us, and it shouldn't even come down to a court hearing. It should be a matter of fact that we have what we want for our body.
I have cancer from head to toe to the bone. And you're going to try and tell me that if I think there's something that's going to give me a little bit of life, that I'm not going to try it?
But the response from the medical authorities has always been the same, even at the cost of looking foolish for the ridiculous excuses they often had to concoct to resist its approval.
If we release Laetrile and ASIAC and Crobizin and so on, I can give you a very long list. You'll have a very wide choice. Then, when there is something effective, how will you know which to choose from?
In fact, someone thought better to prevent ASIAC from being used in the future by doctors who may eventually respond to a higher calling of their conscience.
As it's well known in the state of California, the state legislature actually made it a felony for a doctor to use any than the accepted methods of treatment for cancer, and they named them in the legislation: surgery, chemotherapy, radiation, and cobalt. And when doctors are hemmed in like this and their very livelihood is threatened, they're not going to be anxious to step out of line.
Stay tuned for Part 3, Exposing the Cancer Industry, entitled Quackery Equals Competition.